much. Our team coverage now continues from Call 6 Investigates. New this morning, we talked to an Indianapolis doctor who is the first to set up drive-through testing for COVID-19 right here in Indianapolis for the general public. This is all happening as Marion County, the heart of our state, leads Indiana with the number of people with the virus. It happened on Saturday. It will happen again. Drive-through testing for COVID-19 in an Indianapolis neighborhood. Dr. Dorian Kenley offered the tests as people sat in their vehicles on the 4000 block of East New York. The doctor has a contract with Texas-based AIT Labs to administer the coronavirus screening.
This is about the length of the swab.
Okay.
This is inserted through the nose, and it goes into the back of the head, and we kind of tickle you kind of where the uvula is. So the uvula is the part that hangs down, the dangly ball, as they call it sometimes.
Okay. Sounds painful.
It is not pleasant.
We connected using FaceTime. You're the only one doing this besides Eli Lilly. What's going on?
At the time that I started this, to be very clear, this is something that I tried to put together very quickly to kind of meet the urgent need.
Dr. Kenley hopes to expand his testing to various places in Indianapolis, at least 6 days a week. He charges a $100 flat fee to cover the drive-through exam. He expects that insurance, Medicare, Medicaid will cover the lab testing fee. Why aren't more doctors saying, you know what, let me do this?
I can tell you, based on my experience this week doing this, it is a very, very difficult thing to do logistically. A couple of the challenges that I had were getting the appropriate Medicare emergency approvals. I had to make a lot of phone calls to Wisconsin and Washington to get approvals to be able to do this. I had to establish the lab relationship. Availability of test kits is a big deal, especially for the stuff being distributed through governmental channels, which is one of the reasons I went through a private lab, because I was able to get that online. And hopefully one of the things we're going to see is more involvement from private lab companies to get us the resources that we need.
The Indiana State Department of Health is focusing its testing on the most vulnerable Hoosiers, and at Eli Lilly and Company, its drive-through testing is for now only serving first responders and healthcare workers. Dr. Kenley is among the first locally to make COVID-19 testing available to anyone willing to show up and wait their turn. So let's get right to it. New details this morning. That local testing site, it starts today and runs through Friday. It is open from 10 this morning until 5. The location, 1400 East 12th Street. Meredith?
All right, Raphael, what is the state health department telling you about what this doctor is doing?
Well, state health officials are not specifically commenting on this case, but two things to keep in mind. To get the testing, it must be ordered by the Indiana State Department of Health or your physician, and that testing must be done by an FDA-certified lab.
But ATI Labs, who he is using for the testing, is not on the official lab list for the FDA.
Good catch on that, Meredith. In fact, we did some checking on that. So I spoke to Dr. Jay Reddy with AIT Labs out of Texas, and he tells me that he is waiting, his company is waiting for a EUA, Emergency Use Authorization. You need that from the FDA to run the test. AIT Labs does not have that yet, so they're working with a Massachusetts-based company, Thermo Fisher, which does have its EUA, and it is FDA approved. So as long as AIT runs its test through Thermo Fisher, these tests that the doctor is doing are legitimate, and so for now, all is okay. I should also point out that the FBI did contact the doctor yesterday, and the FBI is watching this process that is now going to sort of develop here in Indianapolis. We'll see what happens.
All right, Raphael, we will continue to follow what this doctor is doing, and we will have more on that drive-through testing later today on the news at noon.